Really interesting study that came out recently in the journal Rheumatology and Therapy. In this study, a group from Italy looked at their patients with psoriasis and tried to figure out which of their patients would be considered super responders when they eventually developed psoriatic arthritis. So psoriasis is a condition where the immune system is overly active and attacking the skin. In about 20% of those folks, they can also go on to develop psoriatic arthritis, meaning the immune system is attacking the joints and tendons as well. So in this study, they wanted to figure out, for those folks who developed psoriatic arthritis, what were the variables that could predict that they would be a super responder to treatment. So a super responder in this study meant that these were folks who, with medical therapy for their psoriatic arthritis, were more likely to go into a very low disease activity status or remission status within 6 months of treatment, and were more likely to stay in that status, that very low disease activity status, at least 2 years afterwards as well. And they found 3 things that are to note. The first is that the folks who were more likely to be a super responder tended to be more often men than women. Interesting, not much you can really do about that variable if you have psoriasis. Number 2, they found that the folks who had a shorter duration between their psoriasis diagnosis and their psoriatic arthritis diagnosis were more likely to be a super responder. That's important because knowing that 20% of psoriasis patients will go on to develop psoriatic arthritis, it means that if you have psoriasis and you start to notice you have inflammation in the joints or tendons, you need to get checked out sooner than later. Because if you do truly have psoriatic arthritis, getting treated earlier means that you're more likely to get into a low disease or remission status, as opposed to if you wait longer, when you may accumulate more damage and then develop a more aggressive form of psoriatic arthritis. The next variable that was really important was that they found that there is a connection between those folks who had well-controlled metabolic health and becoming a super responder in terms of treatment for their condition. Super important, because when we talk about metabolic health, we're talking about being well-controlled in terms of your blood sugar, your blood pressure, and your weight as well. So this is interesting because we're starting to realize more and more that there is this connection between your metabolic health and the inflammation in your body. And that's something that you can control. So if you have psoriasis and if you develop joint pains and tendinitis, get checked out to see if you have psoriatic arthritis to get treated sooner rather than later. And if you have psoriasis, stay focused on your metabolic health, namely by your diet and nutrition being as optimal as possible and exercising regularly as well.